everyone. My name is Kay Huff. I'm the Director of Coaching for Benco Dental, and I welcome you today. I know we're getting started. I can see the numbers climbing as everyone gets signed on, so I really want to get more people on before we start, Chuck. So it's going to be a great webinar. So we're not even halfway there yet, so let's just get everyone on a little bit, and then we'll start off. You know, Chuck, if you want to, I really don't, I want more people on before you start talking about the updates, but you could talk a little bit about, you know, I've heard so much right now about when you're buying your supplies that you have to look for certain things, like maybe an N95 mask is not an N95 mask. Maybe they're selling things that aren't really true. Are there little tips that maybe you can give us if we're trying to buy the supplies? Like, what should we look for?
Sure, absolutely. Certainly, Kay, thank you for inviting me to be here. Glad to be here on Benco's behalf, and we're glad to be hosting today's seminar. The main thing, and again, I'm not quoting Benco, I'm just quoting the ADA. So I don't know if everyone saw it, but Dr. Chad Kahani, who is the new president of the ADA, he's an endodontist from Queens, New York, made it very clear in his recent statement this past weekend that the #1 thing is that all dentists should be aware there are counterfeits out there and should only buy products from reliable suppliers. I'd like to think that Benco is one of those reliable suppliers, as are Shine, Patterson, other reputable dealers, companies you know and trust. In these days when there's a lot of unknowns out there and a lot of uncertainty, now is not a time to be buying stuff from a company you heard about on the internet, on the Amazon marketplace or something, because those who say they're selling an N95 mask or a personal protective product or even a traditional dental product, they may not have what you think they have. As Dr. Kahani said, if it seems too good to be true, it probably is. So the #1 advice is to buy from reputable sources that you know and trust.
Fantastic. Well, I know that people are coming on now, so we got a little over 300. We still have some others that need to come on. But we want to say definitely welcome to our Benco family, and we definitely miss seeing you guys. So if you're on the course today and you want to have fun with us, definitely take a picture of you on our course and share it with us on Benco's Facebook page. We really want to see traffic on that page. And so all you have to do is hashtag Benco Dental when you do your post, and it'll be on our Facebook page, and that way we can share it with all the TRs that are out there and all the Benco family out there that's missing you. So please make sure you do that. So so Chuck, do you want to give an update on the supplies? I think we have. Yeah, we could probably go ahead and do that if you'd like, just to give an update on if because I know a lot of offices are going back to business now, right? Or getting ready to go back.
It's kind of exciting. I mean, we're hearing from around the country that offices in certain pockets are going back in business. Of course, dentistry has been open for emergencies only for the last couple of weeks, and now we're hearing that dentists are starting to go back full time. And as part of that challenge, the question is, what are dentists going to do as far as PPE, personal protective equipment, is concerned? Kay asked me to give a little update on that. So #1, as we talked about before, only buy PPE, especially from reliable sources. There's a lot of counterfeits out there. There's KN95 masks. There's masks that are not approved for a healthcare setting. There's all kinds of stuff that you can buy that may not work for your practice. #2 is we think everyone is going to have to upgrade to a better high quality mask. We are in the process. We just put an order in for $10 million of 3M N95 masks. They're the #1 provider of those products in the world, and we're very proud to be partnering with them to bring those masks to dentistry. We are getting our initial shipments in, so we believe we will have the masks you need when you go to order them, so please talk to your Benco rep. We are rationing because rationing is the only way to prevent people from hoarding. So we're trying to keep things, the supply chain until it all evens out, to have some sort of a good supply for everybody. We do think people are going to want some disposable clothes and some bouffant caps and things like that. We're getting those into stock. Most importantly, we're getting face shields in. So the answer is, for the personal protective products that you need, we believe we'll be able to supply them. Talk to your Benco rep, place your orders, be aware that we are rationing because we do not want hoarding. Hoarding is really the problem in a situation where there's not enough supply.
Fantastic. Thank you for that update. So again, we're super excited that, the offices are going to be going back to work and the team members are going to be coming back. But I want to just go over some of the guidelines for today's seminar. So, you will get CEs for attending the seminar. However, we need to make sure that you registered with your legal name. That's very important. So whatever's on your license should be on the name on your registration when you registered. Also, if there's two of you, make sure that you each sign on to your own computer or your own phone, because it's really important to know that we see that you're on in order to be able to give you the 2 hours for today. Also, you need to make sure that you stay on for the 2 hours in order to be able to receive the CEs. Let's see, and then at the end of the course, you will also get a survey. We just ask that you give us some feedback on that survey, and it'll also just ask you some questions about what some other things that you would like to see. It may take 30 days to receive your CEs. That's fine. You will get it. It just may take a little longer. If you're watching from an iPhone like this, what we need you to make sure that you do, or a cell phone, I should say cell phone, you need to make sure that you please send me your name, the course name, and your telephone number. We need to match up those three in order to match your CEs, because Zoom doesn't recognize phone numbers and names. So if you're calling in from a cell phone, I need you to send in your name, the course, and your telephone number. You need to send that into practicecoaching@benco.com. Again, that's practicecoaching@benco.com. I think I covered all that. I want to make sure when I said post to our Facebook page, it's at benco.com, not hashtag. So it's at benco.com. And then below, you're going to see that there's some questions and answers. Please make sure that you ask us questions. We want to know. We may not be able to get to all of your answers, but this is what I will tell you, is that we will be sending out a list of all the questions and answers to everybody at the end of the webinar. So it may be tomorrow, but we will make sure that Dr. Moorhead actually responds to all of the questions if we don't get to them today. And then everyone will get a copy of all the questions. The Benco team at head office will be sending those out. So I appreciate that. That's really nice. With that being said, I think I did everything I was supposed to. You got your questions and answers. This one, oh yeah, and it will be available for recording later. However, the recording you will not get CEs for. Okay, I think I did it. So now with that being said, this is the best part. This is where I get really excited. I get the opportunity to introduce the managing director of Benco Dental, and all I can say is that everything that he's done during this whole crisis, I can't tell you how many phone calls he's been on or how many emails he responds to, but he's never stopped. He's always been positive, and he's really and truly not only coaching our team members, but also helping our clients to make sure that you're protected and ready to start back up to work. So with that said, I'd like to introduce Chuck Cohen, Managing Director of Benco.
Kay, thank you very much for the introduction. This is great. And my favorite part of these courses is Kay's introduction to me. I only hope that I'm worthy of everything nice that she says. So this is, I think, our 10th or 11th program in the series. I've lost track. We've done so many of them. We put this program together a few weeks ago because we wanted to make a very clear statement that we support dentists and we support dentistry. And we're going to use this time to try to get ourselves educated, to be ready to go back practicing. As soon as the fog lifts, the sun comes out, and we got to go out and do what we love to do, which is make patients happy. Things are going to change. There's no question. We don't think this is an end for dentistry. It's just a pause. For those of us who were around during the AIDS crisis in 1991, as I was, you know that dentistry is very resilient. We are going to figure out how to do better in the future. This is a temporary situation that we will get through. We are very pleased today to have Dr. Moorhead with us. He has a terrific topic, one of my favorites, which is how to error-proof the dental practice by using Checklis. His nickname is Dr. Checklist. He's been practicing for nearly 40 years, although he doesn't look it in that picture he has on the slide. He is a true wet finger dentist, and he's going to bring to you his ideas on how to make sure your practice is ready to not make mistakes, ready to go back to work, ready to grow. So Dr. Moorhead, thank you very much for being with us today, and we look forward to hearing from you.
Chuck, thank you for having me. I'm going to start out by showing you a 2-minute video that I posted on our office social media site the Saturday before the closure. I encourage you to take some notes about this. And by the way, there'll be a handout at the end of the program, and I have this exact script if you want to duplicate something like it. Here we go.
Hi, I'm Dr. Moorhead of Flemingsburg Dental Care. The coronavirus pandemic is a concern to all of us, but infection control is not new to healthcare. Since OSHA mandated dramatic changes in the early 1990s in response to HIV, dentistry adopted some of the strongest practices in healthcare. Because we know you have concerns about safety because of COVID-19, I want to show you what we do universally to make Flemingsburg Dental Care one of the safest places you can be. From the moment you enter our reception room, you'll see we have put social distancing in place. We encourage our patients entering to use hand disinfectant. The entire team always wears protective equipment that's changed between every patient. Our handpieces, the so-called drills, are always sterilized with every use. We use disposable barriers to cover our suctions, our three-way syringes, even our computer keyboards and clock timers. Treating infection, pain, and disease day in and day out requires we keep our office open to the community. And it's our promise that we will always work to keep you safe. Thanks for watching.
Now, I dare say that if I can do that, you can do that too. A little bit of background on me. Like Chuck said, I've been in practice for now 39 years in a little town of Flemingsburg, Kentucky. It is a town of 3,000 people, about an hour northeast of Lexington, about an hour and a quarter from Cincinnati. I've gotten to serve as president of my state dental association, gotten to do some speaking over the years, and I'm certified in IV sedation, and you'll see that enter into the discussion some today. There's my contact information on the screen, my email and my phone number, and I will share that as well as how you can get it a handout at the end of the presentation. I want to let you know as we're starting that the last 30 minutes of this presentation, I've taken Chuck Cohen's challenge and I have reworked the lecture to where there will be there's over a dozen ideas that are specifically titled for Chuck, ideas to put butts in your chair when we return to practice. They're all ideas that will directly increase your productivity, and so you'll want to stay tuned and catch those. So today's game plan, I'm going to show you the advantages of using systems and checklists and how they will help your team to focus and prevent errors. I'll show you exactly how to create system checklists. We'll go by it step by step for all areas of the practice. We'll look at the clinical areas, the front office, etc. And then, like I said, that last 30 minutes will be on how to improve your presentation skills, how to increase your same-day dentistry, all that, more than a dozen ideas. So in getting started, I need to disclose that I'm the owner of StreamDent software. It's the only product by the Streamline Practice LLC. And I also want to share this statement from the ADA CERP that says participants should be cautioned about the potential risks of using limited knowledge when integrating new techniques in their practice. So you already got to see butts in the chair idea number one, promoting infection control. And I'm not going to show that video again. I'm going to show you a short little first 7 minutes of a 5-minute video I just did put on our website. I think it was late last week, but here we go. Just a short little bit.
Hi, it's Dr. Moorhead again. Today I want to share with you some information about how to properly wear masks for your safety. Some state.
Now, I don't need to show you a 5-minute video on how to wear a mask, but the point is there's a lot of people that don't know how, and it's something that you need to educate your patients because it's going to be happening. You have the expertise, show your expertise, and share that information on your social media. It won't take long to shoot. Now, I want to stop my screen share for just a second and go to my video for just a second. If you all will bring up just me on the screen for just a short little bit. I want to give you a little bit of background about how I got started with systems to start with. Now, you already heard me say that I'm certified in IV sedation. I've done sedation now for 20 years, and I certified in IV sedation in 2009. So at 2009, I'd done sedation 9 years, and of this event that I'm going to share, I had done IV sedation for 6 years. I was already in the track to become president of the Kentucky Dental Association at that time, and myself and Tony Feck, who's got a good reputation also for sedation, we convinced two very excellent professors at the University of Kentucky, Ted Raybould and Bob Henry, to start an IV program there. In the IV program, Dr. Raybould and Dr. Henry stressed to us that when you're doing IV sedation, for elderly patients, you go low and slow. You give a very small dose because those drugs can affect elderly patients more so. So I can remember this day as though it happened last week. I had a 72-year-old male patient that came in, not all that complicated a health history. He followed exactly all of the instructions that we'd given him. We got the IV started with no problems. All the vital signs looked good. And I gave a tiny 1 milligram IV dose of Versed, the medication midazolam. And I took longer than normal to watch his breathing. And I heard the pulse oximeter beep, beep, beep going down. And by reflex, I tipped the head back, just like you're taught in basic life support. And I grabbed the oxygen hood for the nitrous oxide, and put it on him. And then I looked back because I knew I had turned it on and nothing happened. We wear radios in the office. I radioed, kind of panicky. The oxygen's not on, get it on now. In what seemed like it had to be 5 minutes, it was probably half minute, 45 seconds, I hear on the radio, Dr. Moorhead, all of the oxygen tanks are empty. We got the emergency oxygen in the room, empty. What had happened in that succession of problems is what educators show is the classic, all of the holes in the Swiss cheese line up to what could have been the perfect storm. I was fortunate that I got my wits together with the help of a team member, and I was able to administer a reversal agent, even proceed with the appointment safely after that. But it was a wake-up call. I had to stop. I had to change how I was doing things. That's how I got interested in systems in earnest. I want you to first look at the way that you're probably doing it already. I call it tribal training. So let's take you back to the first day of practice, and Jane was your assistant, and you taught Jane exactly how you do it the best way possible. Then a few years later, Jane leaves and trains Lisa in her last week that Jane's there. It trickles on down as Lisa trains Edna later, and Edna trains Mary. And these years later, of that training that you gave, or the consultant came in and gave you the ideal way of doing things, it all gets watered down. You can even have a situation where you have a queen bee that decides that they know best, and they wind up taking over your office, and everybody's dependent on the queen bee. As I'm teaching systems in a live setting instead of a webinar, I come with 2 decks of cards. And I ask for 2 volunteers, and I ask them to come up, and I hand them the decks of cards, and I have a competition. So I'll randomly call off a card in the deck, and oddly, the same person every time gets them quickly. And it's set up. It's to teach the advantages of organization, because that volunteer's cards are all in order, where the other set is in random order. They were set up for success. So let's talk about some businesses that you know. I mean, McDonald's may not be your favorite restaurant, but you know every time you drive through, even in the COVID crisis, you know if you drive through McDonald's, any restaurant nationwide, they're going to have consistency. If you order a Big Mac, it's going to be served exactly the same in Flemingsburg, Kentucky, or in Portland, Oregon. Likewise, when you go for that cup of coffee and you know that they get the elaborate order right every time, it's because they use a system on the side of the cup. So simple. So there's an author named Jim Collins, and he wrote a book called Good to Great. And A quote from the book, "The mark of mediocrity is not the unwillingness to change. The mark of mediocrity is inconsistency." So what are systems? Freedictionary.com defines a system as an organized set of interrelated ideas or principles, an organized and coordinated method. Albert Einstein said everything must be as simple as possible, but not simpler. You can break it down to where it doesn't cover enough information. A management system, businessdictionary.com, defines as a documented and tested step-by-step method aimed at smooth functioning through standard practices. So you know that McDonald's and Starbucks are turnkey. The franchise purchases the product, the franchise, and they know that everything that they get will let them, from the day that they open up, do everything exactly right. So is it possible that we could make a dental office turnkey? I think you'll be interested in what I show you. One last definition. A protocol is a medical protocol is a predetermined criteria that defines appropriate medical interventions or describes situation in which a medical professional makes judgments relative to a course of actions for effective management of common patient care problems. A protocol should be clearly defined in writing. It should be individualized to the patient. Monitoring parameters should be present, and there should be a time frame. So in summary, a system is a set of guides to follow completing a task, and a protocol is your plan to execute treatment. Now, you may have heard of the concept of a system failure, and this slide I'm going to show you is off the internet. It's not anything specific to dentistry, but it shows step by step that when something goes wrong, instead of the blame game about why did you do it that way, with a system failure, the beauty is that as long as people are following the systems, you go step by step through the system, figure out what went wrong, and you fixed it. So it's very freeing to your team because there's no more blame game. Now, I dare say that when you get on the plane, you wouldn't want to stay on the plane if you knew that the very highly trained pilot and co-pilot didn't follow the checklists. Watch this video for me. Now, I've cut out the sound. This is a plane landing with no nose gear down. It's stuck. They cannot land. Every pilot trains on simulators over and over and over again for these kind of emergencies. And you see that he kept the nose up, he cut the engines at exactly the right time, and he saved the emergency situation. I'm told there are two types of pilots. There are pilots that have landed with their gear up and pilots who will land with their gear up. I challenge you to go on Amazon and get this read. It's an easy read. It's by an author named Atul Gawande. Dr. Gawande is a surgeon out of the Northeast US that headed the World Health Organization about 13 to 15 years ago. He is the physician that is responsible for changing medicine so dramatically to where they implemented timeouts and checklists at the time. I want to read just a few things from his book because it's key to what we're talking about today. He says, in all learned occupations have a definition of professionalism, a code of conduct. It's where they spell out their ideals and duties. The codes are sometimes stated, sometimes just understood, but they have at least three common elements. One is selflessness, skill, and trustworthiness. But aviators, however, add a fourth expectation, and that's discipline. Discipline in following product procedure and in functioning with others. It's a concept almost entirely outside the lexicon of most professions. He goes on to say that discipline's harder than trustworthiness and skill, and perhaps even than selflessness. We're by nature flawed and inconstant creatures. That's why aviation's required institutions to make discipline a norm. This next slide is a copy from the internet of the World Health Organization on their surgical safety checklist, the first that Gawande and his committee first came out with. Finishing up the quotes from his book, to be sure, checklists must not be ossified mandates that hinder rather than help. Even the simplest requires revising and ongoing refinement. In the end, the checklist is only an aid. If it doesn't aid, it's not right. But if it does, we must be ready to embrace the possibility. We're all plagued by failures, by missed subtleties, overlooked knowledge, outright errors. We're human. There's human error. When we look closely, we recognize the same balls being dropped over and over again by those of great ability and determination. We know the patterns, we see the costs. It's time to try something else. Try a checklist. Now, this is me flying a Southwest flight to Phoenix. No, this is me sitting in a cockpit in Phoenix at a layover. And I really didn't want to sit in the cockpit. I wanted to see this. I wanted to see the system checklist for everything that they do, every possible scenario. It's also, this system checklist is how the miracle on the Hudson happened. You've heard it over and over again. Sully has credited the entire crew because everyone on the crew followed exactly what they were trained to do in the system checklists to save everyone on board of that plane. JADA recognized this, and first in 2010, they published this article that was chiefly penned by Dr. Harold Pinsky. I got to talk to Dr. Pinsky by phone. Dr. Pinsky is a full-time, or at least at the time, he was a full-time regional pilot, and he was a part-time dentist. And he wrote about the advantages of applying checklists to the dental profession. The article says, in medical settings, use of this checklist has shown to improve safety, with post-op complications and death rates reduced by as much as 36%. Now, I admit to you that if you're not doing sedation, it's not likely you're going to face a death situation. But you see the same situations, as Gawande said, that we make the same mistakes over and over again. On with Dr. Pinsky's quotes, the team's consistent use of a checklist for each patient and procedure is a positive step toward reducing errors and increasing efficiency. It's much like the pilots performing safety checks during each phase of the flight because time's not wasted recovering from missed items covered by the checklist. Lastly, he said, consequently, any discussion of safety and risk requires consideration of forward-looking techniques and strategies. JADA 5 years later, and I'm not going to read all of these checklists, but they, knowing how involved placing dental implants are, they showed checklists step by step on what to do to error-proof the process of placing dental implants. I want to share one other thing that I consider a must-read. It came out in 2012, and I have permission to quote from Rory Vaden's book. The book is Take the Stairs, 7 Steps to Achieving True Success. Before I talk about this, I want to show a slide that Rory shows when he's doing presentations. Tell me what's wrong with this. Now, I know this gym in Los Angeles is closed now, but doesn't it seem kind of ironic that they're taking the escalator into the gym? Vaden, in his 7 principles that he presents in the book, his principle on the pain paradox of sacrifice, he says in every decision that any of us make, we go through the same process. There are different elements that weigh in on how we make our choices, but that's where that pain paradox of sacrifice comes in. In every decision we make, we go through the same process. On one side, the process are emotion, feelings, impulse. You hear people say things like, I don't feel like going to the gym. You know that the person that you assigned to the accounts receivable sometimes thinks, I don't feel like calling that patient with the overdue balance. You may have found yourself thinking, I don't feel real comfortable telling my patient about something they need because I'm afraid they'll be upset at what I tell them. Now, on the opposite side, most of us have in our head, working in our favor, logic and reason. Most of us. And these two forces are always sort of on a conundrum affecting how we think. Feelings are generally short-term, like for instance, you stub your toe. So if you stub your toe, are you never going to go walk back on that sidewalk where the curb was? Are you going to make your lifelong decisions based on stubbing your toe? On the other hand, what successful people tend to do is they discount their feelings because they know in the long term, logic and reason will outweigh emotion, fear, and impulses. So simply stated, the short-term easy leads to the long-term difficult, while the short-term difficult leads to the long-term easy. And I could talk to you about getting the new credit card and running out and running it up and coming out with the bags of shopping stuff and then having to face paying that bill for months and months and months versus the difficult short-term thing of saving the money and letting compound interest make easy long-term consequences with your savings. The bottom line is self-discipline creates freedom. Now, why am I talking about all of this stuff before we talk about systems? There's a tendency for us to procrastinate. We do things like creative avoidance, daily acts of trivia. We'll even think we're really busy, but it's not, it's activity, it's not accomplishment. So I'm challenging you to look at things today a different way. So what will systems and checklists do for your practice? Number one, they're going to organize, simplify, and decrease your errors. Your team's going to find out that when they learn to depend on them, that because the checklists literally have their back, they look better. You're going to find that you and your team are making a better impression with your patient because they see that you're efficient and you're thorough. If you apply these systems like I'm going to show you, and I'll show you some examples during a new patient exam, to your exam processes, you can actually increase your treatment acceptance. And if you make it easy to be able to do your setups using checklists, then it's easy to take things from hygiene and from emergencies and add more production daily without stress by adding same-day dentistry. And I'll show you more how. So I want to just show you something that you're probably already doing that's a simple system. This is the practice management system that I use in my office. And with this is 42% of the market, so it's easy to show this. A lot of you will identify with it. This particular practice management system, when they come in the office and they train you, they recommend that you have no more than 25 of those little buttons over there, and you click on that to treatment plan things or to set things complete. But if you go to the bother, and most software can either use multi-codes or explosion codes, things like that. If you go to the bother of setting up those systems to create several codes that are here that are automatically added. So for instance, for a root canal, a post and core, a crown, cementing the crown, if you click on one thing and it puts all of those steps into your treatment plan, and then later you can organize them so that as you click them to be connected to the appointment, your procedure is going to fill out and you're going to have the time that you need to be able to already automate it into the system. There's another example for the steps to do an upper complete denture. Before I go on, let me pause and ask Kay, are there any questions that are already on the table so far?
I think you're doing okay right now, so we can keep going.
Good enough. All right. The first real system that I want to show you, I had to work a bit to be able to learn it. It was created by a dentist down in Tampa area by the name of Vince Monticello. I called his office because I had heard terrific things about this concept, but I called their office and they said, we've had people visit and visit and visit. We just can't take anyone anymore. So they referred me to a practice that had visited them in North Carolina. Called them. I heard the same thing. I finally, by luck, found out that a Dr. Larry Legere, that I had taken courses with back in about 2001 and 2002, that Larry had been to that North Carolina office, and Larry let me come to his office and observe. By the way, over the years, I have learned a lot from CE, and I'm a CE junkie. You're going to be able to tell that. But I've also learned a lot just from going to other dental offices and watching. It's amazing what you can learn by watching some of the masters. So this concept of the whiteboard is something that I didn't consider one of the butts in the chair idea, because I cannot guarantee you it's going to put production on your schedule the first week that you go back. But I think you're going to find out that this is a fantastic tool for improving the flow in your office. So here's the way it works. And by the way, if you have a huge office and you want to do this with a commercial product, there is a software product that you can purchase. And if you're interested in that, you can email me later and I'll tell you the name of that product. But with this concept, you see it's a whiteboard. There are black pieces of permanent adhesive tape that are on the whiteboard. And you see at the top, there are columns for priority, procedure, patient, and room number. And you see the room number start at 2. We really, in Kentucky, do know how to count, but room number 1 doesn't have equipment in it yet. You also see there's a lab, a note, or a column, or a row for consult, and a row for lab. So when the room is set up and ready for the patient's name and the procedure are written on the whiteboard in the room. You see some check marks in a couple of rows. When the patient is seated, you place a check mark to let them know that the patient's ready. Now, with this system, doctor, you have to be willing to delegate where you're going to go when you come out of your operatory to your team. I promise if you'll give this a try, it's very freeing, because instead of you having to scramble and guess and where you need to go next and not quite know for sure where it's going to be, you've delegated that decision to your team and they talk it over. And then where you're going to go is placed in the priority. So when you come out of the treatment room, out of the operatory, you go to the whiteboard and you look and you see, for instance, right now, I've got to go into room 5 where we're going to be doing endo on tooth number 12 on Kathy, and I've got to numb up. Then when I'm in there, they change the priorities and they want me next to go to the hygiene room number 2 and do a hygiene check on Jen. After I do that, I'm going to go to room 7 to numb up Mandy for a surgical extraction. I'm sorry, just room 6 to numb up Susan for those composites that are really simple little Pitt and Fisher things. And then while those fillings are being placed by an expanded duty, then I'm going to go to Mandy and numb her up in room 7. Last of all, with this system, when the patient is gone and the room needs to be turned around, you put a mark through their name to show that that room is ready to be cleaned up, disinfected, and ready for the next patient, which after COVID-19 is going to be a little bit more involved, but that's not today's discussion. This next system I'm going to share with you is a system that Dr. David Ahern out of Massachusetts shared with me. Dr. Ahern is also an architect. I went to his office and visited back in 2004, and then I had him, a dentist and architect, he designed my office as well. But this idea he allowed us to share, and this is 1/4 of a page, so you print them 4 up, and it's a page that the hygienist fills out as soon as they have finished data collection. On the top left, they mark whether it's a new patient, yes or no, the operatory number. On the top right, the type of exam, a comprehensive exam, new patient prophy, a recare appointment, or a perio appointment. They put in their name, the hygienist's name if there's more than one, the time that they're going to end. And here's the concept. They send this or take this to you in the room where you are as soon as they're finished with data collection. And you've got on the note how long you've got to get in there to do the hygiene check so that the hygienist and the patient is not left sitting. You make a better impression, the hygienist stays on time and is more productive. There's rooms on there for the hygienist to make some notes about what x-rays and photos were taken, about whether the patient's apprehensive. The hug list is little special notes that let you have some quick talking points to be personable. Let's face it, We're dentists and we're task oriented mostly. And that lets you very quickly have something personal to say before you lean the patient back and do that hygiene exam. And at the bottom are some areas by quadrant of urgent needs required. And for instance, if there's deep caries on number 3, the hygienist would put number 3 up here, deep caries, etc., to tip you off on what he or she has seen for a preliminary diagnosis. So let's start creating a system. And I'm going to share with you my system for doing a morning huddle. Morning huddle, the investment in that 10-minute time can tremendously increase your productivity and your communication with your team. So, for our morning huddle, we go over what happened with numbers the previous day. We go over a spreadsheet, and I got this idea from Larry Legere in that visit in Pennsylvania back so many years ago. We go over the goals compared to what was accomplished, both in charges, payments, unscheduled treatment, etc. We look at yesterday's presentations, and we have some rules. We only need to discuss unscheduled patients and make sure that the proper person is assigned to be able to track them. And if we need to send them any resources, that's the drip marketing reference, to help them in making their decision. Do we need to accomplish any record transfers, any information from referrals from dentists that we're going to be sending them to, or physicians that we need information from, narratives for predeterms. And then we use a rule that we put in the appointment book, and we simply make a note in the appointment note field to follow them up at 2 days, and if they're not ready to make a decision, at 2 weeks and at 2 months. And then if they haven't made a decision by that point, we follow up in the recall system. Then we are going to go over today's patients, identify any special issues. My hygienist is fabulous. Kathy goes through all of our charts, her charts the day before, and has done a chart audit. I'll show you that list in a little bit, but we have a set protocol of exactly what things we're going to go over for the morning huddle. This is her chart audits. She goes through to look who needs to see x-rays. The chief thing that she does at the meeting is she tells me about any unpresented treatment, so I'm ready to focus on that when I come in the room for that hygiene check. For larger offices, you might need to have more than one huddle. You may want to have a separate huddle for the front business assistants to be able to go over financial items. Some offices have people coming in at various times a day, and so you may have more than one meeting. I know of one office that's very big that the team just routinely has a timeout before they go into the treatment room for each patient and reviews the health history and what's going on so everybody's on the same page. That's exactly what Gawande teaches and surgeons and their teams do in the operating room now. Any questions, Kay?
I think we're doing good. Some of the questions that are coming up are some of the ones about the N95 mask. Those are going to be addressed all later in another seminar. So anything that has to do with, the regulations and what's going on with that, that's going to be addressed in another seminar, and I'll get to that at the end. So other than that, I think we're doing good.
I do have some questions that do pertain to the presentation.
Oh, go ahead, Leah. I'm sorry. Go ahead, Donna.
How are you handling your PPE when you're jumping from room to room?
Well, it's going to be more difficult because the latest guidelines that I'm seeing are that it's going to be smart for us to stay in the room and not be going from place to place. And when we leave, that we're going to need to remove all of our PPE. I can tell you that in the past, I have taken my mask off and left it in the room. I have discarded the gloves. I haven't had to worry about the coats and the hairnets and that kind of stuff. But if I'm going to use expanded duties, I'm going to get everything done that I have to get done. I'm not going to leave the room for a hygiene check. I'm going to see the advantage of the pink slip is I'm going to be able to do those hygiene checks in between patients when I'm ready to leave anyway. So if I'm able to continue using expanded duties, which I hope I'm going to be able to do, I'm going to be going through more PPE, and that means Benco's going to be happier. But I've got to weigh the cost of the PPE versus the productivity that the expanded duty can accomplish, because it's got to start all over from fresh every time you go in and out.
Got it. I have another question.
Yes.
Should the doctor be in the morning huddle?
Absolutely. It's important for the doctor to know what's going on. You see, the advantage of the morning huddle is the head dental assistant and the hygienist and the business assistant are able to brief the doctor so that the doctor can quickly get on board on everything that needs to go on. And then if there's any particular questions, that gives the doctor an excellent chance to be able to ask them at that time.
Great. And where does this whiteboard live?
In my office, it lives, we have a long hall with all 7 operatories. I told you one of them was empty. And then in the middle is sterilization, and it's on the wall next to sterilization for our office. So someplace centrally located.
Great. And do you have any morning huddle sheets, any information that you could provide us to what you use as far as an outline is concerned with your huddles?
I don't have it in the handout that I gave you, but if someone wants to email me, I can be glad to share that. Yes.
Okay, great. Thank you.
I foresee that there's going to be a revised handout with additions. And as a matter of fact, now I'll be sharing with you at the end. I've got the handout already where your Benco reps already have the handout by the end of the day. I'm also going to have them available on my website, and I can be able to update that one to include things like the morning huddle. Just remind me afterward, please, Donna.
You got it. Thank you.
Any other questions?
That's what we have so far.
Okay, good question. All right, now we're going to start on Chuck's list of butts in the chair. These are all ideas that can immediately improve your bottom line. Catherine Itel Belt is a good personal friend, and the seminar that she did with Kay last Friday was awesome. And my goal today is not to teach you phone skills. I do want to talk on systems to be able to implement those phone skills well. But the biggest thing on the butts in the chair system number 2 has to do with specifically going back to work after the virus. Let's face it, dental offices are not the favorite place for patients to visit normally anyway, for a big part of the population. But then let's add in there that we have this virus to deal with, and will I get sick? And I'm almost afraid to call. So the one thing that I specifically am encouraging you to trade in your team, even the person that's in the front office that's already freaked out by being there themselves, where they're anxious about being in the dental office. I encourage you to make time before you start seeing patients to talk over skills, to be on the phone, reassuring and caring and having extra patience. That's going to go a long way toward making it more likely that the patient, the new patient that calls your office, is going to be willing to actually make that appointment. And that patient of record that calls, that's concerned about what you're doing, you've made the time before you reopen where everyone is on the same page and you can reassure them about what you're doing, just like you saw in the video. And of course, I'm going to redo that video that I showed at the beginning of the presentation, because I've got to be able to show my patients exactly what we're going to do to keep them safe. I want them to know that it's safer than being at their home. So in creating a system for answering the phone, when I create my systems for phone calls, and this one, for instance, is for someone that called and is scheduling the next appointment. We have templates for someone calling for their recare, someone calling for emergency patient of records, a new patient, etc. But for instance, for scheduling the next appointment, how to answer the phone, how to look up the appointment in the practice management system and the time codes, what to do financially and scheduling scripts. I also like to have tools at the front desk to where my business assistants know how to answer tough questions. So they can get information at their fingertips. If someone calls and they say they've got a temporary crown off, instead of the patient's on hold for 2 minutes while the business assistant goes back and asks, they've already at the click of a switch, click of a mouse, they've got information that says, see if the crown is back from the lab. If so, get them in pronto. And if not, exactly what time code to schedule them for to resubmit the temporary or remake it if it got broken. So let me show you some examples of these systems. You see on our system checklist, we've already got answers to the COVID screening questions. And that's for our interim time when we're only supposed to be seeing emergencies and urgencies. But they've got exactly what to say to answer the phone. Hi, thank you for calling Flemingsburg Dental Care. This is Mandy. How can I make you smile today? They look up information in the practice management system to make sure that the name matches who is on the phone. And if they don't, they ask some additional information to make sure that they're following the HIPAA regulations properly. They look up in the chart to see what's treatment planned and then make sure that that's what the patient is ready to do. They see if there's a in the account. They look to see if there's a credit balance. They look to see if the lab work is back for the appointment. Our rule from my office is if the patient's portion is less than $200, they just go ahead and schedule the appointment. If the patient's part is more than $200, then they've got guidelines on how to make financial arrangements. And then scheduling the appointment, a skill that I learned from a couple of scheduling gurus that I like to teach is 3 key questions to be able to get the patient in when you have available rather than having the patient ask you all over the place. It saves a lot of time. The first question is, the business assistant knows the first 2 times that are available on the book. So would you prefer to come in Wednesday or Friday? By the way, if they're not available Wednesday or Friday, they're going to tell you. Is early or late better for you? And would 2:30 Friday work? And propose that time. And then close the call. So that's an example of a front office checklist. For a system checklist for clinical, I like to have instrument setups, room setup, consent forms, procedure steps, and steps to dismiss the patient. And let me show you examples. In the middle column, you see the things that the dental assistant needs to bring in the operatory. Now, we use a computerized checklist to be able to do things. So we have some hyperlinks that can be able to bring up photos of the tray setups, but you can do the same thing and photograph your tray setups and label them in Photoshop so new team members can learn your setups quickly. Same thing for tubs. I don't know what's going to happen with tubs when we go back to work. We're going to have to rethink that concept entirely. Kay's shaking your head, yeah. I like to have my dental assistants place burrs in the burr block. Well, doctor, I don't know what a 245 burr is. Well, you look at the photo that we've taken of the burr blocks, and it's always in the same standardized place. That's a system. By the way, a note about Gawande's concept, this checklist. Am I going to make my experienced dental assistant take extra time to check everything on the boxes of what they're bringing in? No. Someone that's learning needs to use a checklist in a checklist fashion, but someone that already has competency, they set up for the procedure, and then they take 10 or 15 seconds to find the checklist and make sure that everything's there. Then the system has their back, and they look good. I trained an office in Fresno, California, and they bragged that after they put the systems in place, despite the fact that they have 4 doctors that does it different every time, each doctor does things differently. Every time they've always got everything in the room and they look good, and they liked that. Room setup. Gawande teaches if it's something that everybody knows how to do, then don't include it in the checklist. Don't slow things down. Now, I have the advantage of an electronics checklist, so that little routine setup box opens up and it gives the list of things for a trainee. I like my dental assistants to go over consent forms, and I don't want them reading the great big long thing in the practice management system. So I've given them the least number of words that it takes to be able to go over the consent form. I use the concept of benefits, risks, alternatives, and if nothing's done. And this is an example of the consent form that I have them go over instead of reading the great big long thing. And a disclaimer, you should always have your professional liability carrier review your consent forms before you're using them. This is an example, that same one, there's a one of endo. But again, the least number of words to get the point across. And when I go in the room, I ask two questions. Well, actually, I ask one thing and then I say one thing. I ask them if they've got any questions about the consent form that the assistant reviewed. And I go over any specific situations. For instance, it's a maxillary tooth and it's a molar and the root's up in the sinus, and I'll underline what the dental assistant already talked about to do with this small possibility of a piece winding up in the sinus. And I'll tell them if I have a piece break off and I can't see it, I may elect to leave it there and tell you about it so we can follow it up later or send you to a specialist rather than have the risk of that worst problem. That makes sense? Okay. Likewise, you need to have lists of your post-op instructions so that you can delegate those things. If you make time to template it all out, I've got to tell on myself, for probably 2 out of my 4 decades, I would not delegate post-op instructions to anybody. I did them myself. I thought it was a pride issue because I could do them better. Well, I found out when I documented them that not only could my dental assistants do just as good, but I could be more productive, and it was a better use of my time. End of procedure. We found out that we needed 2 checklists, one for the things that need to be done before the patient leaves, and the other for after the patient leaves the room. And the bottom line is the patient is dying to get out of there at the end. They've been in the chair, they've been laying back. I've learned the skill of not pushing the dismiss button until you're ready to let them go. If I need to talk to them, I still set them up, but I tell them, hang on, don't go yet. I've got to go over some things with you, but have the list separate of what you need to do before the patient's dismissed and after. So that's an example of a clinical system. And I think it's easy. It can be easy, way easier if you invest the time. And this is why I talked about the Rory Vader book. If you take the short-term difficult and you design your systems, then long-term it becomes easy.
So a couple of questions.
Yes.
So do you have these checklists designed inside your software?
I do.
You do.
Yes.
And then, so it's automatically in your software. That was one of the questions. And then
now this is not a commercial presentation, so I'm showing you exactly how to do it. But yeah, they're all customizable checklists.
And on some of these checklists, is this what you're doing to prepare to reopen your practice after COVID-19? Is that what you're doing? Now, again, I know everyone has to check their own states. Every state is different. But is this kind of what you're doing to make sure that you're up to protocol in your state?
We will modify the room setups to be able to include those. I've got pop-ups for room setup, and I've got pop-ups for cleanup afterward, and those are going to have to change for sure. Yes.
Gotcha. Thank you.
Yeah. And I would encourage you, each individual dentist and team, if you do nothing else with this lecture, make out written what you've got to do until you can learn it up here and it's automatic. Have those checklists for getting the room set up and for turned around so that you don't make mistakes that could affect your health. Okay? We use checklists for setting up in the morning. We use them for end of day. And I started a concept, by the way, I want to call your attention to the one on the top right. I have at least 2 or more times literally lost an expensive handpiece. And most likely it went out in the trash. So we added a system that whoever is doing the shutdown at the end of the day, and I'll talk about that in just a second, but they count the handpieces and they have columns to keep track of the ones that are not sterile yet, the ones that are already clean, and the ones that are being repaired, so they can do a count and know that everything's there. And the simple rule is if anything's not accounted for, they don't take the trash out. It doesn't mean they have to stay all night, but the trash doesn't go out so you can find it. And let me tell you, it works. I have and we've got weekly maintenance things. I have for quite a few years now hired someone, and the person that's doing it now, his name is Dalton. He is a gem. He is not a student anymore. He went through high school and college and then came back to work for us. He's got a degree in being I'm sorry, Dalton. I hope he's listening, but it's in being a social worker, and he can't find a job. It's the typical millennial situation, even before COVID-19. So he's still working for us, and he is so dependable. He comes in about 3:30. And you can do this with a high school or college student if you've got the checklists. Now, I don't have Dalton turn in checklists to me anymore. He still uses them, but he doesn't leave them on my desk like I required the high school and the college students to do. But if you hire a student that is detail oriented, you don't want a strong people person that wants to be out partying with their friends. You get somebody that's willing to be there, and it's okay being there after hours by themselves. You can pay that person well, way better than what they would get working at a fast food restaurant, but they shut down, restock, and sterilize. And the team members, otherwise, when the last patient leaves, they leave. So it's a win-win for everybody. And you notice on this morning checklist, turning the oxygen tanks on, and at the end is turning the oxygen tanks off. Because what happened to us, and I didn't tell you the whole story, when the Friday before that Monday morning, almost catastrophe, someone checked the oxygen supply and ordered some because we had the great big huge tanks. We had a half of one of those tanks left. It should have lasted for another week easily, but they ordered the oxygen. It was to be delivered the next week. They didn't turn it off. And then the next hole in the cheese, someone left on the oxygen in the treatment room. It drained that tank empty. And exactly the same thing happened to the emergency oxygen. So again, that's how my life changed, and I became so interested in checklists and systems. So we've got a column for each room. You see room 7 there, but exactly what needs to be done. This seminar is going to be online later. If you like the idea, you can get in there. You're not going to have the exact same checklist, but you can get some ideas on what you would want to do if you like to implement this concept. Now, this is not a butts in the chair topic. And this is not to me. I just have to bring up one thing. And I had this on, I took out most of my things to do with productivity tools. I normally have this in a productivity tool, but now it's really important to do with infection control. And we're talking about devices like Isolite and Dry Shield. I own 2 Isolites and 1 Dry Shield. And I have become a big fan of the Dry Shield, and I'm bringing it up specifically, and you can get it through Benco. The Dry Shield has a much more superior suction, a very strong suction. And I have ordered the Dry Shield also has the advantage of having not just single-use mouthpieces. They have, I'm sorry, I have autoclavable ones. I have just ordered of the Dry Shield what Isolite already has. I've ordered single-use ones. But bottom line is a rubber dam when we go back to work after COVID, when COVID's still going on. When we go back to work, a rubber dam is the most ideal because it's going to trap what's in the mouth behind the rubber dam. But that's not practical for surgical extractions, for using a cavitron. And I think these devices, and that's why I'm especially fond of the dry shield, are going to be very useful. The dry shield also has the advantages you see on the right here. The isolites are made to be left in the room. If you're going to take them from room to room, it's a bit complicated. The dry shield is just a simple little elbow that hooks into your HVE and you're ready to go. And there is a company that might be sponsoring the presentation, their stock numbers for the dry shield. For error proofing, a timer in the room, which now has a piece of clear tape over it so we can touch it, is a great tool for cutting down on errors. We set a timer when we place topical, when we do local anesthesia, when we start mixing the impression material. For instance, the impression material, you don't time it exactly and you take it out too soon and you got to remake. And it's kind of obvious I don't have scanners in my office yet. Or you leave it in too long and you waste time. So the timer is a tremendous productivity system. This is our patient checkout, and I'm getting ready to talk about systems for checking out patients. We have step-by-step in our system for checkout. I like to use handoffs, and I'll talk about those in just a little bit. But then after the handoff, you want to get some information before the patient leaves to make sure that you got the count all correct for filing the insurance or being able to contact the patient for the next appointment, etc. Exactly what to do about taking the payment. We have lists on the next appointment to where I don't have to write down each time how much time is allowed because we've got all of those in lists that my team has at the front desk at their fingertips. On recall, we have templated out exactly what to say for scripts. And I want to share a script that my consultant, Jennifer McDonald of Dental Management Advisors out of Atlanta, shared with us. This is what she calls the VIP script. And I don't need to read it to you. The concept is for the patient that's due in 2 weeks, you don't call and confirm the appointment. You use this script as an excuse to be able to ask the patient if they have any changes in their health or their insurance. Now, you're using it for that, but you're also using it to get a preliminary idea. Otherwise, 2 days before, it's, oh my gosh, I forgot about the appointment. Can I reschedule it? So that little system saves failed appointments. We have checklists for the front office. I have checklists for both of my dental assistants. Some offices need them for scheduling assistant, for financial coordinator, and for hygiene coordinator. They can be broken down beginning of the day, middle of the day, and end of the day, because if checklists are too long, they can wind up being a detriment and actually slow you down. On our inventory control, we do inventory once a month. You all heard me say earlier that David Ahern designed the office, and he had us use these simple little tools like you get from Home Depot or Lowe's, just tilt out bins. But not only are they convenient, it's side inventory, so you can see what you're out of without having to open drawer after drawer after drawer and closet after closet after closet. And we do it once a month. And when we do it once a month, we don't have to keep duplicating things. We have a list of things that we know we're almost always going to have to order every month. And then we go through the side inventory for the other things. Kay, do you have any questions?
Let's see. So if we don't have these protocols and written policies, how do we start implementing them with the staff, and how difficult is it?
Well, one of the reasons I think this is a timely topic is when we go back to work, I wish I had the crystal ball, and I forgot to ask. I wanted to ask if Chuck could get those in to be able to sell them at Benco, working crystal balls, because we don't know if our chairs are going to be full because of backlog of not being in the office for a month or two, or if they're going to be empty because patients are going to be scared to come in the office and they need to earn a paycheck because they haven't been able to work for a month or two. With that said, if you wind up with the latter scenario where your team is there, they're being rewarded with the salary that you can pay them with the PPP loan, then why not make the time, go through the list, be making some notes as I go through the rest of this presentation on the things that you feel like can have the most impact on the checklists, and some time that you've got available where there's no patients in the chair, have the team meetings and decide where your priorities need to be to start implementing.
And then the other question is, post-COVID, are you thinking about collecting in advance? I've heard of this. Your thoughts?
I have systems for both check-in and check-out. We are going to have to be able to schedule the next visit, so we've got to talk that one out. The advantage of check-in before is the patient can leave immediately if you also have systems in place, and that's one of the beauties of checklists. You can cross-train easily. So if you have your system for checking out and you have it available to the dental assistant in the clinical area, they could check out the patient or make the patient's next appointment because they've already had the financial stuff done and be able to let them head straight out the door. And that is ideal from what they're teaching us so far post-COVID stoppage.
I know. So I think there was one more. I think, Elizabeth, you want me to ask it? I'll ask it. It says, so are you going to be giving away any of the handouts, or are you going to be like any of the tips on doing the handouts? Are you going to give away any information on that?
It does have some stuff already in there. Yes.
Okay. So we'll be able to email those out to the people that stay on. Is that correct?
That's correct. And I'll also have an updated with more information on the website within a day or two.
Fantastic. Thank you very much. And then someone else just said you're doing a great job. They love your idea of the checklist.
Thank you. Okay, so most of the rest of the presentation is those butts in the chair idea. And the first one is implementing teledentistry and developing the related systems. I've already signed up for 2 teledentistry products, and I already canceled one because it did not impress me. Ideally, you want it to be HIPAA compliant. You want it to be able to register the patient digitally. You want to, if you don't have the ability with your practice management system to do e-prescriptions, you want to have that ability. It's ideal to have a module where they can put in their credit card or debit card to where you can be able to bill for the visit directly through the teleportal. By electronic charting, I'm not talking about charting the mouth. I'm talking about having a way to record your notes. I have not run into any teledental product yet that is integrated with our practice management systems at all. So the only integration that I'm seeing so far is creating a PDF to put into your practice management system documenting the visit. If you're going to do any prescribing of control substances, you are required after, now there's a, no, I take it back. Even now, if you have a DEA license a DEA permit and you need to give the patient a controlled substance, you must have a recorded 2-way video that you retain. And then with that video, it's good to be able to do photo sharing and screen capture so you can put something in your practice management system that shows the big hole on tooth number 28 and why you justified giving that antibiotic, et cetera. Totally off the subject for teledentistry, I was fortunate to attend with my sedation classes a class about 5-6 years ago on using NSAIDs and acetaminophen for post-op pain. And if you use an NSAID pre-op, for instance, 440 milligrams of naproxen sodium, and then afterward give some Tylenol immediately, and then you keep combining both the Tylenol and the NSAID, they are 30% more effective than the narcotics we used to use. And that's beyond the scope of the checklists here. If you want more information about that, email me at the end. I have done sedation using a product like Celebrex that you can take the night before, and then the Celebrex if there's no heart problems, and Tylenol afterward. I do 98% of my sedations, including full mouth extractions, without narcotics. So back to teledentistry, what I found out in using it is, number one, it is not efficient for the doctor to be doing all of this. So you've got to have a system where you can be able to delegate. And step one, on account registration, the business assistant needs to create an account, both in the practice management system and in the portal. Ideally, the system should let the patient be able to fill out the information. Some do, some don't. Then the patient goes in and fills out the medical history. I hope that the teledental product that you bought has that ability, and a problem-focused dental health history online. They send in their insurance information and they enter their credit card information if the teledental product has that. Then once that's completed, the first opening that the dental assistant has makes a preliminary phone call or video, goes over the medical history and the dental history so that the doctor's time is used efficiently. And then the dental assistant, while they're on the phone, looks at the schedule, sees when it's likely that there's going to be 10 minutes for the doctor to make the phone call, the video call, ideally. And key point, this is an appointment too. So you've got to stress to the patient that this is an appointment and they need to be ready to accept the video call when it comes through. Then after that, the doctor does the video call, ideally recorded. We talked about the screen capture advantage. Then the doctor documents it. They have to type clinical notes either in the practice management system or the portal, but they should copy it from one to the other. And then afterward, there's a handoff to the business assistant who either then or calls back and schedules the actual in-office visit and then bills insurance or the patient accordingly. So that's brand new because I've just had teledentistry in my office for about 2 weeks. Now, I don't have time to go over the entire new patient experience, so I'm not going to show you the entire template on what we do for a new patient exam, but I want to show you two key things that are some of the biggest things that can put butts in your chair and increase your productivity. I know all of you have intraoral cameras, or most of you. I've got one. We don't use it except for single shot things when I'm in the chair with a patient for insurance documentation or to be able to show the patient afterward. We use digital photos. We have an SLR camera, and the rule with the SLR camera is going to have to be, it's going to have to be done first before the PPE is on and before we're getting involved with handling the patient, et cetera. I mean, we've got on the mask, but we don't have on gloves to handle that, or we're going to have to figure out a way to put a bag over the operational part of the camera. But I want to show you what we do with the digital camera. We take a full face with a smile close up, retracted, closed and opened, and mirror views. When I first started doing this years ago, I got pushback from the team because it seemed to take so long. They can do this now in 2 minutes. And by the way, we do this for new patient comprehensive exams, and we do it once a year on ReCare. And again, my hygienist, Kathy, I've got to brag on her. She didn't like this at first. She brags about how, and she tells the patients how we can be able to show them the difference in the recession on the screen by the ones that we took 5 years ago and today. We can show them how the attrition is getting worse because we had recommended that bite guard and they didn't do it. And it helps to increase follow through as well. So this is an example of the photos that we take. And after we take the photos first, even before we do the medical and dental history, we do a patient interview before that. I'll share that in a system in just a tiny bit. But with that on the screen, before the doctor ever comes in, we sit the patient up and we look and we ask them what they would like to change. And if they say something, the next question is, what else would you like to change? And we keep asking that until they run out of ideas. but you see that you can show them the attrition. You can show them the cracks that are in their teeth and the hole in the filling. You can show them the big fillings that need full coverage or an onlay. Then directly related, system 4B for putting in the butts in the chair is train your team, develop scripts to address the patient's concerns, what they say they're worried about when they look at the photos. Now, I'm not a fan of scripts to the tune of, do you want fries with that? But what I found out is I had a lot of analogies that I use, and my team members heard them over and over again. And one day I come in and I'm listening to the dental assistant, it was Kathy at the time, and she says, this, you know, when you see this little yellow area where you've got wear on the tooth, that's like your tooth is an M&M, hard outer shell. The hard outer shell is the hardest structure in the body, and that yellow is the inside of your M&M. That's where the softer layer is showing through. And I found out that if I documented these analogies, then my team ran with them. Your team may already know them. So when they bring up a script, they have some key words in red there that just remind them of the analogy, and they run with it, and they do tremendous at it. Butts in the chair, idea number 5, using handoffs for continuity. If you've had consultants in your office, you may have heard them talk about the analogy of a relay race, where you're handing off the baton from person to person. We use systems, handoffs throughout everything that we do. And for instance, every patient, before they leave the operatory, I'm going over with them why I want them back in, what I want to do next, and why it's important. Then they go to the front office, and Kimberly walks them up to April, and she repeats the exact same thing that I just did. First, she goes over what was done today. Then the patient's hearing all this repeatedly. Doctor wants the patient back in because they're trying to avoid the deep decay on number 3 and hoping to avoid a root canal. And by the way, when the patient calls back to April and says, I'm going to put that visit off on working on that tooth next time, doctor said it wasn't that important. But April heard during the handoff that it was deep decay and really needed to be addressed. And April is empowered then to be able to go ahead and address it and be able to reinforce the need to keep that appointment. Butts in the chair system number 6, the new patient interview. This is asking a set of open-ended questions, and you see them on the screen there. Now, we use the electronic thing, so we have a place to type them and transfer them to the clinical notes, but you can have a list on paper of these. You can bring it up on the video and use my open-ended questions. And we've got a list of what the most frequent answers are, but we want to get in the patient's words their chief complaint, why they're there, the motivating factors, what obstacles are in the way, etc. And the way the system works, we do this before the patient goes back to the treatment room, before the photos are taken, and this is done by the business assistant or whoever is going to be presenting the treatment and making the financial arrangements at the end of the appointment. So they're already empowered with what the patient said is important. And then on handoffs, when the business assistant introduces the dental assistant, they go over these key things. And then when the doctor comes in the room, the dental assistant goes over them with the doctor. So the patient knows that we've listened to them, and they know that we know and are addressing what's important to them rather than what's important to us. This productivity tool for the offices that I consult with tell me it saves them an hour or 2 of billable procedures, billable time for the doctor, each doctor in the practice, a month. So think, doctors, if you didn't have to spend the time, you know how bad polypharmacy is going. I mean, you may on average spend a minute or 2 on going over a health history, but it can be 5 or 7 minutes for something that somebody's got a list of medicines this long. So If you, doctor, put in your dental assistant or hygienist's hands the questions that you always ask when the patient has arthritis or diabetes or hypertension, and they can be able to ask those questions ahead of time and document them in your practice management system, then you've got instant billable extra time to be able to work on patients doing something besides busy work with the medical history. Yes, you're going to have to go over it, but it's going to take you a minute instead of the longer time. Butts in the chair system number 8, flexible payment arrangements. We're going to come back to the office and there's not going to be money in bank accounts, and we're going to have to go the extra mile if we expect to do any work. Now, I would say most of you have outside financing like Care Credit. And my Care Credit rep, and I'm lucky to know a couple of vice presidents in Care Credit that have taken really good care of me, but not everybody qualifies for Care Credit. I found a new tool, and I want to thank Rachel Wall out of Charlotte, North Carolina, of Inspired Hygiene. She helped me with this one. I've used debit card kind of things before, but they had gone out of business. And so she connected me with DocPay, and you see there's a link there where DocPay has offered to do a special offer for people watching this seminar. But DocPay will do not debit cards, they will do ACH entry. That's using the routing number and the account number. And the beauty of it is it does not cost the practice anything. Now, quick review. Outside financing, those companies are without recourse. If they do the financing, the patient, if they don't pay, they don't come back. Care Credit does not come back and ask you for money back. If you do the in-house financing, you're keeping the money on the books. So there is risk. But I feel like that we're going to have to look at patient past history on who did pay the bills and decide who we can be able to go further with our financing now to be able to get to do the work. And then on that vein, I feel like we're going to have to be more liberal with those in-house arrangements. So if you're going to do that, look for the patients that have insurance coverage, look for the procedures that have a lower copay. So if you're going to offer the longer financing in-house, then you know the procedures that are going to more likely get paid at 80% instead of 50%, and you can have you've prioritized your list now on the people that you had to cancel. Prioritize the list of the productive procedures that either you know the patient has the money or it's a lower copay, and get those patients in the door first. Butts in the chair number 9, techniques to prevent and manage cancellations. This will take you a little bit longer, but if you work on systems to prevent cancellations, the skills that you use on the phone to do your confirmations, to use on your text messages, to lessen the chances of you having the broken appointments, and you have set ways to be able to deal with if someone is canceling, so you can try to rescue the appointment or document it properly so that if there are broken appointments, and I can't show CDT codes because of the ADA's rules, but they only have 2 codes for broken appointments. So most practice management systems will let you have dummy codes. In my practice management system, we can put a dot and a suffix afterwards. So for instance, the consult appointment is the code .c, the emergency failed appointment is .e, et cetera, and the same thing for the canceled appointments. By doing the diagnosis on your failed appointments, then you can find out where your problems are. And by the way, if you take my advice and you add those codes to your practice management system, have the failed appointments show up in all caps, where on the ledger and on their statements, it shows failed appointment, canceled appointment. And also when you're scheduling the next appointment, they show up so you can see if the patient has had problems with failed appointments in the past. Idea number 10, train to promote specific services. This idea, when Dolly Gaines was in our office as a consultant, helped us together. We formed this system in a team meeting, but the idea is the things that you want to do most, figure out the talking points that you want your team to have to promote the investment choice, to promote you, the doctor, to promote the consult, the idea of why it's worth the long-term investment and how to handle the objections ahead of time. And you can come up with a lot of things for your offices that you want to address with besides dental implants. Assisted hygiene. We're going to have a backlog of patients. How do you do assisted hygiene and stay in the room? Well, you got to be organized. So you would have to have 2 or more dedicated chairs. But doctor, if you don't have enough chairs filled with your patients because of the virus, dedicate them to the hygienist, dedicate those rooms on a select basis even. Maybe last of the day or the first of the day or a specific day. And take one of your dental assistants that's not busy with you, train them on exactly how to be able to assist that hygienist. And if you're going to do assisted hygiene, you can't do intensive procedures. You can't do root planing. Now, of what I've heard so far on the guidelines, prophies would not be considered a big thing on creating aerosols. So these rooms are not going to have as intense turnaround, but that extra assistant is doing the room turnaround while the hygienist is being more productive. Does that make sense? We're getting toward the end. Same day dentistry. If you
let me know when you want to answer some questions, because we have quite a few. So let me know when you're wanting to answer them.
Okay, let me get through 2 more and then we will. Same day dentistry. The hygienist has to do the exam early, and then if he or she sees something that thinks could be addressed and knows that there's time on the doctor's schedule from the morning huddle, then they notify the doctor so that they can come and do the exam early. They've got scripts that are used. For instance, I know to say when the patient's in the chair, Donna, would you like to go ahead and get that done today so you don't have to waste another trip? And I was hesitant when I first heard that, but I tried it and it works. So you can get same day dentistry from emergencies, doing the extractions, go ahead and start the crown. Likewise, you may get some things from hygiene if you're organized and have it all preset to where you're doing single 1 or 2 fillings, single crown, things like that. And then last idea, this is a bonus. This is something near and dear to my heart. I've been in practice 39 years, and for 38, way ahead of when it became popular, I started doing a day when we shut down the office and do charitable dentistry. And you're saying, but doctor, how's this going to put productivity on our books? Because you promote this with social media, you'll get free advertising from people in the area, from the newspapers, the radios, whatever. This makes your practice look good. And if you want to do this, I've got everything documented in the handout, step by step on how to do it. And if you have questions, I'm there to help you, because this is something that's near and dear to my heart. Okay, Kay, go with the questions.
Unmute. So I'll answer a few and then we'll let Donna answer a few. So let's see, the one I had, let's see, I'm unmuted, right? Yep, here we go. So would a hygienist be able to use Isolite or Dry Shield on her own, or will she need to have an assistant to use it properly?
The reason I have more than one Isolite to start with is my hygienist kept taking it. Now, what they're saying of the latest guidelines, though, they're recommending the Isolite be used and an HVE. So if a hygienist can be able to use an HVE and a Cavitron at the same time, I think that's doable, but they've got to hold the HVE properly. I mean, this is the proper way to do it, and if they're handling it improperly because they're trying to do it all themselves, then it's not going to protect them, the hygienist, or the patient. You're going to have to play around with it and see. You can watch and see where those aerosols are going to some extent to get an idea. We're going to have some guidelines coming out too.
Yeah, Donna, do you want to reply to that since you're a hygienist? Are you on, Donna? Nope. Okay. And then as far as does your SLR camera automatically upload into Desix?
They do not upload to the practice management system. You have to do that in a manual operation. And that's why there are Wi-Fi camera cards that you can get that will transfer it, but we didn't find that much advantage in them versus putting the camera card in the computer. It's going to take a couple of minutes for the business assistant to put those in the software and be able to crop them. That's why we do that before we do the health history.
Okay, and then on the teledentistry, what system do you use? There's two questions to this one. What system do you use, and will you still use that when you reopen? I guess they want to know how you would reuse that.
Okay, is it okay for me to mention a brand name?
I mean, if you want to say what you're using, that's
Okay.
fine, and they want to know if you'll still use
I
that.
won't mention the one that I signed up for and canceled. I will say that the one that I canceled would allow free setup, and the one I signed up for cost a $300 setup and then $150 a month, but it's Patient Pop, and Patient Pop's primary product is not teledentistry. They do marketing that I don't do with them yet, but they, of the ones that I checked out, it looks the slickest, and it has those features that I talked about, or almost all of them. You're muted, Kay.
So would you still use it after the coronavirus is over? And if so, how would you use it?
I think that there is a place for it because you can productively be able to screen a patient, find out what their problem is, instead of having to delay that emergency patient a few days to be able to get them in. You can be able to go ahead and do it that day when they call, which looks good for your practice. Go ahead and get them on an antibiotic if it's needed, and then be more likely when they come in to be able to get a definitive treatment done.
Okay, and then this one's about aerosols. How does a hygiene not create aerosols, polish, or Cavitron?
Again, I'm not a hygiene expert. I do know that it's going to take some extra effort with Cavitron, and of anything that I've read, it is the biggest risk going in is the Cavitron. I don't know how we're going to be able to get off thick calculus like I saw an emergency patient on Monday and had to, I had them on an antibiotic before because they were swollen from the perio condition, but I don't know how we're going to do that yet. So we're going to have to wait for some guidelines. I'm sorry, I don't have that crystal ball.
And then I'll ask her one more, then I'll let Elizabeth answer a few. Does Dry Shield take only a high-speed suction, or will it?
It has to have a HVE, yes, high speed.
Okay. Okay, Elizabeth, go ahead.
Okay, I think you've probably, we've been over quite a few of them because they're all asking the same questions.
I have a feeling that you and Kay have gotten some idea for some future webinars too.
Okay, can you prescribe any medication to a new patient by teledentistry?
You can, except for a controlled substance, and then you can do the controlled substance if you have a recorded video call. I don't know if that is going to change when the closures stop. I don't know how. I know right now you can.
And how do you feel, or give us a comment on hygiene care for pediatric patients? Do you see pediatric patients in your office, and how would you be handling those?
I don't see that many pediatric patients in my practice because of the IV sedation. We do more adults, so I can't address that one directly. I'm sorry.
Okay, thank you.
Oh, I will share one thing to do with pediatric and adults. I saw the neatest idea because we're going to have to come in the room with a N95 mask, safety glasses, face shield, maybe a hairnet. They had a picture of themselves with no PPE on a plastic coated thing. So picture of the healthcare worker and their first name to help be more personable. And that's something we're going to implement soon. Okay, may I wrap up with the last two slides?
I think so. I think that was all we had. So there was something about aerosols, but I think you answered that one. Yep, that's it. Thank you.
Okay. The likelihood of you doing something with the content that we covered today is the most likely if you go ahead and start writing down some steps right now. So I challenge you that are watching this today to, before you get up from the chair, at least make the time to write down 3 things that you feel like would help your office the most from doing this. And you might screenshot this, use your phone, or use your computer to be able to just take a shot of that screen right there and later go back and write out the steps that it would take to implement those 3 things, what you would expect for the results, and then with your team, create a timeline. And I promised information on how to get the handout. Either get it from your BENCO rep or go to my website, streamdent.com/free resources. No, we will not put you on a mailing list, I promise. And if you want to contact me directly, there's my email address, dr.m@streamdent.com. And that phone number is a Google Voice number that rings into my cell and my office phone. So if I'm with patients, it's at my desk, obviously, but they'll answer or I'll get back to you promptly. Kay, this has been tremendous. Thank you so much for the opportunity.
Fantastic. Thank you. So there's a few things I want to go over one more time because not everybody was on about the CEs. And so let me just make sure I go over these if you don't mind. And then I think they're going to switch over to take over the PowerPoint. Number 1 is that when you registered, if you didn't use your legal name that was on your license, just send us an email and we will make sure we correct that for you, because if you're Bill and you use William and Williams on your license, you need to make sure you registered in your legal name. The other thing is that you had to make sure you watched the webinar on 2 separate computers. And if you logged in using a telephone, you need to make sure that you send your telephone number, your name, and the name of the course to our practicecoaching@benco.com. Again, just email us your telephone number, your name, and the name of the course, and we will then be able to connect those with the CEs. The CEs are going to take about 30 days to receive. So if you haven't received it, don't worry, we will get them to you. It may take about 30 days. Again, they just put it up. We also would love to have some of your feedback, but this is the practicecoaching@benco.com. And again, with the questions and answers, so what we're going to do is we're going to take all the questions that were asked today, and we're going to give Dr. Moorhead a chance to answer them, and then we will put them on one list, and we will send them out to everybody on the webinar. So it won't be until probably tomorrow or maybe sometimes next week, but you will be able to receive all of the questions and the answers from today's webinar.
Kay, let me ask a question of you.
Sure.
I looked at my clock wrong. I thought we needed to stop at 5 o'clock and I was rushing. If you like, I can go through a few more slides or I can end at this point, but I wanted to offer.
No, yeah, you have about 15 more minutes if you want to go over them, and then I'll just go back over this. Go ahead.
Okay. Thank you. I'm sorry.
No problem.
Let's get back to share my screen.
Yeah, share your screen again.
There we go.
Perfect.
This is from a time management class that I took from Stephen Covey back 15, 20 years ago. With every task that you do, there's a level of whether it's important or not important and urgent or not urgent. Category 1 tasks are things that are deadline-driven activities, crises, pressing problems, emergencies, last-minute preparations. Those are the things that wind up wrecking your schedule because you didn't plan. Category 2 are relational building, personal development, employee training, which I'm encouraging you to do with this seminar, exercise, health, prevention, and planning. Category 3, I need to hand in that report that was due 2 months ago, but just one more funny cat video. That's how stress happens. Category 3 is let me drop everything and work on your problem. It's the things that you have dumped in your lap. And that's the emails and phone calls, the interruptions. That's where your team with proper delegation, doctors can be able to help you out by intercepting those problems. Category 4 is recreation, and it's things that belong in your life at home, not in your practice to make you productive. In terms of what it looks like in a dental setting, category 1 is necessity and you manage it. Category 2 is quality and personal leadership. That's where you should be focusing. Category 3 is deception and use caution or avoid it. And waste for category 4 is the things that you want to avoid in the office. So to terms in that matrix in the dental office, the emergencies that come up that you couldn't have planned for, like when the oxygen tanks were all empty. That became a class 1 urgency that took over things. Your category 2 items that you're trying to focus on is your employee training, your planning and developing your systems. And then going back with Rory Vaden's book with one more of his principles, and again, I've got permission to use these. He says that with the buy-in principle of commitment, the more we have invested in something, the less likely we are to let it fail. And in terms of you making decisions on what you're going to implement in systems, or in any class that you go to, any webinar that Kay offers you in the next few weeks or has offered, the time that we spend deciding whether we're going to implement actually is more than the time it takes to actually execute the outcome. And attitude is choosing how you see things. So in making that decision, there's a pivot point that we come to where instead of deciding, am I sure I'm going to do it versus I'm in it for good, the question is not, if you want to do something, it's not should I, but how will I? So get to that pivot point and make your decision and move on. Another thing that holds dentists back, most of us are perfectionists, and we want to wait until we can do it perfectly, but life is messy. You can't fear messing up. The way to get it done is to go ahead and bite off the little piece of the elephant one bite at a time. Let go of the perfection and realize and embrace that success is messy. His law of diminishing intent says our intention to complete an activity is highest now when you create the intention, and then it gradually fades. So with this material, with any course that you ever take in the future, the likelihood of you doing something, that's why I showed those action steps. The likelihood of you doing it is if you go ahead and make the time to do it now. Procrastination, as I mentioned before, is one of the most expensive and visible costs in business today. And success means doing things we sometimes don't want to do. So there's the action steps again. And if you didn't get a screenshot of that before, please take a moment to do it. And then there's my contact information. Thank you, Kay. You've got to unmute again.
Yeah, we have a few more questions. Hold on, I unmuted. Okay, hold on, let me just get this out of my way. All right. So are you seeing emergencies alone right now or having a team member come in with you?
I am lucky that I've got 3 people that are coming in with me 1 day a week to be, I'll do the teledentistry ahead of time. And for temporary, I can't do a controlled substance, but temporarily HIPAA has removed the restrictions on what we can use for teledentistry. So if you don't have a teleportal set up yet, what I have been doing is I have the patient, if they have the ability to print forms, they've got a computer and a printer at home, I have them go to my website. I don't have a product, and there's some good ones I can't mention because of the ADA rules, but there are some good products for doing paperless questionnaires. I used to use one of them, and we found out it was more productive at the time for us to eliminate those. We may have to revisit that, but I have had the patients go on the website. I told them exactly what to download. It's a 2-page emergency form, and it's a 9-page HIPAA form. I ask them to print the first and the last. If you want to see the forms that we use, you can go to my office website. It's flemingsburgdental.com, FLEMINGSBURG dental.com, and go to patient and patient forms, and you can see the paper forms that we give the patients to fill out in advance. And I have literally had them take a picture of the filled out form with their phone and send the text that to me, since I didn't have the teleportal in place. But we are allowed temporarily to use FaceTime, WhatsApp video. We can use a telephone call. You can use Facebook Messenger. If you have it, you can use Zoom or whatever. You know, as a dentist and a healthcare provider, how to be able to use Zoom. There's a little bit of trick in being able to teach a patient how to download that program that I think could be problematic. And by the way, the Zoom healthcare version is secure, but they don't record video, so I don't consider that a good long-term solution. They don't do the other things that I showed you on my wish list for teledentistry either. Did that answer the question well?
I think so. I will say this, you have to make sure that your state allows you to do it. Texas does not allow teledentistry. So you do need to make sure that you check with your state if you're going to do teledentistry, because it's not allowed in all states even right now.
Have they relaxed the teledentistry
No,
regulations?
no.
Kentucky
Not
did
in
not have the Kentucky Dental Board did not have them written entirely. They were working on them, but they declared we will relax it and let you do it without the regulations now because of the crisis.
Unfortunately, no. I mean, that's what I heard that was out there, was that Texas was not. And so I would say just make sure that you check with your state to make sure that you can do it. Another question they ask is, what pre-rinse are you using with adults and pedo? I know pre-rinse is something that's really big right now. You want to talk a little bit about that? I mean, that is I know Donna has done some research on that also, but pre-rinse is really important.
I'm hearing at least a 1% hydrogen peroxide solution. And right now we have not bought either Peroxyl or Listerine whitening. Both of those are a 1%, and those taste good. We are using a bottle of hydrogen peroxide, pouring the 3% a little bit and diluting it approximately twice more to make it 1%, and asking the patients to swish with that for 1 minute. A question that I have not figured out yet. The patient comes in, and I have seen a few denture patients that had things that could not wait. They were having problems. I do a technique taught by Jack Turberfeld. It's a tremendous friend now and mentor. I use hydrocast and impression material inside my diagnostic dentures, and that material can go bad. So I've had to see some of these patients. So do you have them swish with the dentures in or out? And I haven't gotten the answer to that one yet. I've been having them do half and half, but it's a bit of the wild, wild west now.
Wow, that's a different question. Yeah, we'll have to look into that one. I'll have to get Donna to look into that one too. So, and then the other.
Give me the answer too, okay?
Yeah, Donna, do you hear that? I think she's still on. And then the other question was new gowns for every hygiene check.
I think it's going to be likely, yes. I don't know how it's going to pan out, but it's going to be expensive. Yeah.
And then
what I need to find out from the guidelines yet is if it's a new gown for every patient or for every patient with an aerosol procedure. There's a big difference there.
So the other question is, will we be able to pass on the increased PPE costs participated to our patients per visit? Will the dental insurance create a code for this? So I kind of heard something about this, but I'm not going to say. Go ahead.
Well, I can go back, because I've been a practicing dentist for 39 years. I can go back to what happened with HIV, because that's when we had the first huge bump up. That's also why dentistry is more ready than most other healthcare professions to start with, because where we're higher risk, we had the most stringent guidelines from OSHA back 30 years ago when HIV happened.
I remember that.
And there was a time when we did, and it wasn't billable insurance at the time, but we billed a set fee per appointment for the infection control. And that may happen temporarily again. The hard part now that wasn't happening 30 years ago, PPOs were not around that set our fees for us, and we didn't have the flexibility. Now they set the fees, so we may have to do an add-on fee that is not billable to insurance either. And then what if we get into having to do an expensive test at several $100s just to document whether the patient has the virus before we can put them in the chair? It's going to be
I mean, it's going to a lot. There's a lot that's going to change out there. I can't imagine how different it's going to be, but I can only think that there will be some new codes that are. I'm sorry.
I want the crystal ball.
Yeah, I do think that there will be some new codes out there, but remember, even when they put new codes out there, they're not always paid right away. But you know, a lot of these dentists that are on these PPOs that really have to add all this expense on, you know, that's another good reason why, you know, really looking at your insurance and what you're doing right now. We're going to have Roy Shelburne on, and he's going to do a workshop for us, because it's so important that we make sure we cover these, because we just had Laura on and she did a workshop for us. And I do think that, you know, you have to get paid too to be able to protect your patients and be able to, offer all the things that you need to buy to make that happen. Correct?
That's correct. And I heard one thing talking about each operatory going to need $20,000 worth of equipment. And with the way we've had closures, the idea of spending $120,000 to be able to continue doing dentistry is scary.
And then as far as your checklist, will your checklist, the software that you use on your checklist, will it work with like Open Dental and other software?
My checklists are not specific to practice management systems. So there are checklists for training a team on how to do. So they don't need to integrate. Since they're customizable, you can add things specific to your practice management system. I have one set of forms because I use a particular, the 42% of the market, that it covers more for those things, but it's not meant to be a software training tool. It's meant to be a training tool to be able to train new employees, to be able to cross-train, and to be able to error-proof. And I've got to brag on something. I can be able now with all the systems, typically industry standard, to be able to bring someone into dentistry that doesn't know dentistry.
Yeah, no, I can see that.
It's usually a 3 to 6 month learning curve. And that's to accomplish competency, which I define as being able to work on their own and know where to look it up. I can accomplish with the checklist competency in 30 days, front or back office, and I've done it over and over again.
Yeah, well, I mean, that's just like Starbucks, right? Like, I mean, their protocol is amazing, and they can bring someone in and teach them how to do that. Chick-fil-A is another good one that you can look at, and they're just totally amazing on checklists, right? So I definitely want to tell everyone to please go to your website, because you do create and you do have a software system that they can actually work with and create protocols for their own practice, right?
Yes, thank you.
Fantastic. So we put your website up again. Let me see if I can get them to pull my slides up one more time so I can give people, because they're asking some questions about, one more question is so to be able to, the reusable gowns, or are you going to use disposable gowns? Have you decided on that, whether you're going to use washable or disposable?
It will depend on what the guidelines are. The decision may be made for us, so it's too early to tell that yet.
Yeah, it's crazy that this is probably one time I will tell you that you can have a seminar and you can be looking at today, and then tomorrow is completely different. Is that not?
That is absolutely true. Yeah.
We've actually had seminars where we said one thing one day, and then all of a sudden the next day it was something else. So, okay, guys, let me just go back and say this one more time. I'm sure we did it nice and slow, but I'll say it again. Please make sure that you take this email address down. It's practicecoaching@benco.com. If you have any problems with your CEs, please email us and we will make sure it's taken care of. If you've signed in under the wrong name and you're not your legal name, email us and let us know this. If you used a cell phone, please email us your name, your cell phone number, and the course that you're referring to, and we will make sure that we attach that to get your CEs. All your CEs will be emailed to the email address that you signed up signed up with. And it takes about 30 days. So again, be looking for that in your email. If you don't see it, this is the email address, and we'll be happy to make sure that we take care of you. All the questions and answers that were done today, Dr. Moorhead will get those over to you so that you can respond to them, and then he will send them back to Benco, and we will send all the questions and answers out to everybody who was on the call today. Is there another slide, or is that it?
May I brag on you for just a second, Kay?
Please do.
I've known Kay for several years in the speaking and consulting networks, and Kay has a unique perspective that I think you can learn from to do with this crisis. Because a couple of years ago, when the hurricane went through Houston, she lost her entire home.
We did.
And imagine what that's like. And she continued being positive. She worked through it, just like we've got to work through it now. But if you can look at what you've got to handle a day at a time. Don't worry about what's got to happen a month from now or 2 months from now. It's all going to change. You're going to find out. You're going to learn. Remember, like the slide said, you're not going to have perfection, but life is messy. Embrace it and take it one day at a time, just like Kay did with that big loss a couple of years ago.
That was terrible.
Thank you.
You're
You're a fantastic example.
Well, I appreciate that. And I will say this, I had great support around me. So, when you stay busy, you keep going. Just like right now, we all need to be planning for when we reopen and how we're going to take care of our patients. This is an upcoming webinar. You can actually hold your phone up to the SKU code and take a picture of that, and it will automatically take you to the sign up for this. Dr. Jagani is going to be on with Chuck Cohen, and we're super excited about that. They're going to be doing an interview together, and that's going to be on April the 22nd at 4:00 Eastern time. It's going to be 1 hour. That's going to be fantastic. I think that's going to be a great thing to come in and watch, and hopefully we'll get some upgrades about what's going on and updates about maybe some of the changes that are happening.
Kay, this has been awesome. Thank you so much.
Thank you. Save the dates, guys. Here's some upcoming workshops that we're going to be doing in some modules. So please make sure you put those on your calendar and watch for us. We'll be sending them out on our Facebook page. Is that the last one, guys, or is there one more? I think that's it. So we did it. Thank you, Dr. Morad. You were absolutely amazing. Thank you for all your information. Again, we want to hear your feedback. So please make sure that you give us anything that you want to know to practice coaching at Benco. Give us some positive feedback. We really appreciate it, and thank you so much. Have a great afternoon, Dr. Morad. Thank you.
Bye.